So today we're going to give our lovely patient a little bit of neurotoxin treatment. I'm going to use Xeomin to treat her forehead, the glabella, which is where the frown lines, the 11 lines form between the eyes, and the crow's feet. Not that she really needs anything. It's just for demonstration purposes. So I've already marked the regions that I'll treat with a little wax pencil, and now we're going to get started.
So, Dr. Berger, how quickly the effect will take place?
Xeomin is rapid acting. It will begin to decrease the wrinkles, if you have any, in you'll start to see effects in maybe 4 or 5 days. By 7 to 10 days, you should see the full effect of the treatment.
And meanwhile, is it okay to go to the gym and be physically active, or there are some restrictions?
So these are good questions. Pre-care, before treatment, it's advisable, if you can, not to take any non-steroidal anti-inflammatory drugs like ibuprofen and naproxen. If you have to, so you have to. If you have some other medical reason, headache or what have you. But it's better if you can avoid those, get a little less bruising, but not a big deal if you can't avoid taking that. Not too much alcohol the night before either. It also can lead to a little extra bruising. And afterward, the questions that you're asking, you don't want to be bending down to pick things up, no strenuous exercise, etc. until the next day. And also the same cautions with regard to non-steroidal like ibuprofen and naproxen, as well as alcohol for 24 hours after the treatment.
And if you're doing treatment now, how long I can anticipate the effect to last?
So the overall treatment should last approximately 3 months. So I usually have people come and follow up between 3 and 4 months, ideally around 3, because if you start treating, before it, really starts to wear off, then, you don't have any gap, and you also often require less Botox or whatever neurotoxins being used. Here I'm using Xeomin today, but you may need less if the more often you treat. So after 3-4 treatments, you may not require as many units as you did the very first time.
And is it painful?
You've had it done before. What do you think?
It's not painful, and I love the effect. The fact that there are no wrinkles and it's so beautiful. At some point I was thinking to grow the bangs to cover my forehead, but now it's a great option to have, like I'm doing, and there are no wrinkles.
Yeah, exactly. Okay. All right, so now we're going to do the treatment.
And they're saying that Botox helps with the migraines. I mean,
that is correct. So the treatment that we're doing today actually is part of the treatment to control or treat migraines as well. But in addition to the upper 1/3 of the face that I'll do today, there are also points in the scalp and in the back of the head and so forth that are treated. And by weakening those muscles a little bit, not so tight, it can help a great deal with migraine.
And does insurance cover those?
For migraine treatment, it can. It's kind of a complicated process to go through insurance for coverage. It can be done, but that would only be for a medical indication with migraine, which is migraines many times per month. I don't recall the exact cutoff number for insurance, but it's 14, 15 migraines per month. It's significant migraines, or insurance won't be willing to cover.
All right, I'm ready.
Okay, so look angry. And a little bit of a pinch now. Angry, angry. Not too bad?
Good. You have very good hands.
Glad to hear it. Angry again.
It's like mosquito bites. Then,
That's what people say.
so no gym for 24 hours.
That's correct. You can just put your feet up today and relax. Let somebody else take care of the heavy lifting.
Living the dream.
How it should be. Okay, so that takes care of what we call the glabella. That's what makes the frown lines between the eyes. Next, we're going to take care of the forehead. So horizontal wrinkles, we call them rhytids of the forehead.
Sometimes it's impossible to get rid of those forehead wrinkles if people haven't done anything for many years.
That's correct.
It's
So what you're
almost-
alluding to is the preventive benefits of early Botox or other neurotoxin. I use Botox because it's a household name, but I often use Xeomin and Dysport, which are similar to Botox as neurotoxins in general. But yes, so I mean, I'll use myself as an example. I have this pretty deep horizontal rhytid, the way my forehead tends to wrinkle. And if I had started Botox in my late 20s, early 30s, if you were able to look closely, you'd see that even when my forehead is at rest, static, I have a little line there. And then you think of it like a piece of newspaper. The more often you fold it, the deeper the crease, and the crease won't go away when you fold the paper flat after folding it a large enough number of times. So Botox can be used preventively to prevent the wrinkles from becoming static lines that you see even when you're not wrinkling your forehead, for example. Yeah, that's a good question. A little pinch. Doing okay?
Mm-hmm.
Pinch. Pinch. I'm just going to do 2 more on the forehead, and then we'll take care of the crow's feet and you'll be done. Okay, a little bit of a pinch. And now the crow's feet, turn to your side a little. And squint into the sun, there you go. These can be just a little sensitive. Squint. And when I ask the patient to make faces, as it were, identifying where those muscles are that are causing the wrinkling. And by the way the toxin works, just for everybody's edification, is it weakens the muscles. So if the muscles are not getting quite so tight, squint again, then they don't make such significant wrinkles. The wrinkles will be diminished, if you will. Squint really hard. And that is a complete neurotoxin treatment of the upper third of the face. So the glabella, which are these lines that form when you look angry, frown lines people call them. The horizontal lines or rhytids of the forehead, as well as the crow's feet. So in addition to just cleaning off everything with the alcohol like I'm doing right now, I'm also going to apply some arnica gel, which will help diminish chance of any bruising.
And can you tell a little bit about, can you talk a little bit about the promotion that you have for D-Sport, Botox, and Xeomin?
Yeah, of course. So currently, ordinarily I charge $14 per unit, but right now for Mother's Day, not that it's only for moms, but we're offering $12 per unit, which is really quite a good price, especially when the person doing it is a highly trained physician, in my humble opinion. And so again, no heavy lifting. Somebody else does the dishes, the cooking, the cleaning today. And in a few days, voila.
Thank you, Dr. Berger.
My
I feel
pleasure.
great, and
My
it was
pleasure.
not painful at all.
Very good. So, as always, thank you for watching. Feel free to reach out to us at Northeast Medical Practice. The phone number is 516-604-3418, or you can find us online at northeastmedicalpractice.com, as well as on Facebook, Instagram, and LinkedIn. And we will see you next time.
Thank you.
Bye-bye.
Bye-bye.